My name's Vee Mapunde. I'm the Program Director for the NHR Surgical MedTech Cooperative. So it is a research infrastructure funded by the Department of Health and Social Care. And what we do is we help to accelerate the development and evaluation of new technologies that can be useful for patients in the NHS. Our particular focus is surgery, mainly general surgery. However, we do have neurosurgery as well within there because the MedTech tends to cross-cut and can be applied between neurosurgery and colorectal because it's sort of soft tissue areas. I think our main incentive for getting involved really is about exposure, and it's also about raising awareness of the different supporting organizations and links within the ecosystem. So for instance, if you're a pharmaceutical company, there's lots of places where people know and understand the system, but it's not necessarily the same for MedTech and health tech. And what we want to do is raise awareness of that so that it smooths the journey for a lot of innovators working within the space. So the panel I spoke on was MedTech Ecosystems Collaboration. And this is about just showing the number of different units that exist across the north and what they do and how they interface with each other. But it was also important for the audience to realize that we're not in competition with each other. It's very much a collaborative effort. If we cannot do something, then there's always another unit that can. It's also about breaking down the barriers in terms of the regions, because there's always this thing that people think, if you're going to work with a unit in Leeds, then you can only do something in Leeds. And that's certainly not the case. What we want people to see is there's a whole range of support out there, and we want them to be able to approach any one of them. And the road, if we are meant to work, for example, with ourselves, the road will always lead you back to the Surgical MedTech Cooperative. I think, there's loads, but I think in terms of what's definitely emerging as technology in the medtech sector is the whole work around artificial intelligence and the work around wearables. I think wearables are going to become a key thing, particularly for early diagnosis, and AI is absolutely instrumental to that. So that's what I'm definitely looking forward to see how artificial intelligence helps to actually boost the capabilities of existing sort of technology and existing hardware. Collaboration is essential. Ultimately, anyone who's developing health tech or med tech, these are things that you and I are going to use. And as Georgia said earlier on in her opening speech, our health is the most important thing to us. So if you're going to be developing any health tech, med tech, you need to ensure that you've covered all your angles. You can't have a technology that's going to cause more harm than good. And in order to achieve that aim of not doing more harm than good, you need to be able to work with different voices, different perspectives, to make sure that whatever technology you introduce is not going to introduce a health inequality. So just one example most will be familiar with was during COVID with the pulse oximetry meters, where they actually found out they're actually more accurate. The lighter your skin color, the more accurate they are. The darker your skin tone, then the less accurate you are. So what is the point of having a technology like that that's actually going to give false readings and inadvertently put other people on the back foot? So collaborations are very important because one person doesn't know everything. One company doesn't know everything. And it's important to pull out those different voices to make sure you've sort of done a risk management or risk assessment of this technology is definitely going to benefit the most people.